Hi Dr. Friends. Today's topic is about the microbiology quiz. All questions are behalf of your as a revision topic for all medical PG exam, either NEET PG, FMGE, nearby DNB exam, AIIMS PG exam, and second year MBBS exam. You have to choose a right answer and you have to say or write your score in my comments box. I will describe all the question. Best wishes for this quiz. Let us start microbiology quiz first. Start with first question. The most frequent cause of scalded skin syndrome. The option is Staphylococci, Enterococci, Pneumococci, and Meningococci. Right answer is Staphylococci. The first scalded skin syndrome. Scalded skin syndrome. It is the toxin-mediated illness caused by Staphylococci. It also causes the toxin, also causes toxic shock syndrome, food poisoning, Staphylococcus scalded skin syndrome, and toxic epidermal necrolysis. Next question. Mannitol, salt agar, is used for isolation. The option is Gonococcus, Pneumococcus, Staphylococcus, and Pseudomonas. The right answer you have to choose. It is Staphylococci. The mannitol salt agar is a selective media for the Staphylococci. Another media also used as a selective media for Staphylococcus is Columbia cholesterol nalidixic acid agar. Another, the Ludlam's media. It is lithium chloride and tellurite media. In the mannitol salt agar, here the mannitol is 1%. Mannitol 1% and NaCl are used, which are NaCl are used, which are 7.5%, and indicator are used for such is phenol red, or it is also called as salt milk agar. Next question is most common biotype of S. aureus causing human infection. Option is A, B, C, and D. You have to choose right answer. Right answer is A. It is most human pathogenic strain belongs to biotype A. Next is staphylococcal pathogenicity is indicated by coagulase positivity, hemolysis, lipoticoic acid, endotoxin. The right answer for such is coagulase positive. The coagulase positive organism is staphylococcal pathogenicity. There are numerous virulence factors responsible for pathogenicity of Staphylococcus aureus. But the most consistent association of virulence is production of the coagulase and to a lesser extent ferment mannitol. Next is all are true regarding staphylococcal toxin except the option being beta hemolysin, so hot cold phenomenon, mainly endotoxin, enterotoxin causes food poisoning, and exfoliative toxin causes Ritter syndrome. Here, mainly the option is B. Due to Staphylococcus or gram-positive bacteria, it release toxin, exotoxin, not endotoxin. Endotoxin, you have to remember the trick. Endo start with N for gram-negative bacteria. Here, Staphylococcus not release, not produce endotoxin. Okay. Next is, which of the following is gram-positive bacilli? The gram-positive bacilli, option is Staphylococcus, Streptococcus, Listeria or Meningococci. Here the question is asking about the gram-positive bacillus. The Staphylococcus, Streptococcus are gram-positive bacteria. Okay, it is cocci organism. The question asking about the bacillus, and bacillus are Listeria. So the right option will be Listeria. And meningococci are gram-negative cocci, while that of Staphylococcus and Streptococcus are gram-positive cocci. Question about bacillus. Next is synergohymentropic toxin of Staphylococcus consists of, option being alpha toxin, beta toxin, gamma toxin, delta toxin, and pentan-valentine toxin. The right option for such is gamma toxin here and pentan-valentine toxin. Next is for phase typing. How many phases of Staphylococcus aureus are used? The 12, 15, 20 and 23rd. Right answer is 23rd. It is a pattern or method where set of 23 standard typing phases of S aureus are used to type staphylococcal, isolate and distinguish them from one another by their pattern of susceptibility to lysis. So answer is 23rd. Next question is, all are true regarding resistance of penicillin in Staphylococcus aureus, except what is the wrong answer? The penicillinase production is transmitted by transduction. Methicillin resistance is due to change in penicillin binding protein. Hospital strain mostly produce type D penicillinase. Next is, penicillinase production is plasmid mediated. Here the option first is penicillinase production is transmitted by transduction. It is right answer. Due to transduction mode are for the penicillinase production, while that of next is methicillin resistance is due to change in penicillin binding protein. This is also correct option. Hospital strain mostly produce type D penicillinase. Here you have to remember hospital strain produce type A strain, not type D strain. So type A penicillinase are produced by hospital strain. So this is wrong, and penicillinase production is plasmid mediated. It is also correct answer. So this is option. Next question is staph aureus causes erythrasma, cancroid, acne vulgaris, bullous impetigo. The correct answer is bullous impetigo. The impetigo of the bacteria is divided into two groups. One group is bullous, while second is non-bullous. Bullous include bullous impetigo, which are caused by Staphylococcus aureus, staph aureus, while that of non-bullous is caused by Staphylococcus and Streptococcus pyogenes. So you have to remember impetigo of two types, bullous, non-bullous. Bullous is caused by Staphylococcus, while that of non-bullous is caused by both Staphylococcus and Streptococcus pyogenes. So right answer bullous impetigo. Next is which of the following organism is implicated the causation of botryomycosis? The option is Staphylococcus aureus, Staphylococcus albus, Pseudomonas aeruginosa, and Streptococcus pneumoniae. You have to choose right answer. Right answer is Staphylococcus aureus. This is cause mycetoma-like lesion called as botryomycosis. So not confuse the fungal like. So organism is Staphylococcus aureus. Next is question is all of the following statements about the Staphylococcus aureus are true except wrong answer is most common source. Option is being most common source of infection is cross infection from infected people. Next, about 30% of general population is healthy nasal carrier. And next is epidermolysin and TSS toxin are super antigen, and methicillin resistance is chromosomally mediated. The first option is most common source of infection. The most common source of infection of the is cross infection from the infected pupil. This is wrong option. This is wrong. Due to the most common source of infection of staph aureus are endogenous infection from the individual own colonizing strain. So, and most common route of infection is skin. And next, in hospital infection or nosocomial infection, hospital strain are also known as nosocomial infection, which transmit staphylococci by the hand of hospital personnel, which transfer strain from one patient to another patient. This is, and the 30% of general population being nasal carrier and 10% carrying it on perineal skin. So second option is also right. First wrong. Epidermolysin and toxin, toxic shock syndrome, toxin and epidermolysin are super antigen. This is right answer. And methicillin resistance is transmitted by chromosomally mediated. This is also right option. So false is most common source of infection is cross infection from infected pupil. Next, the most common staphylococcal phage strain causing hospital infection. This is option is 80, 81, 79, 80, 3A, 3C, 69, 70. The right answer is 80, 81. This is the fast typing, so I will not detail about that. Only you have to remember the phage strain for hospital infection is 80, 81. Next is blood culture is positive in which infection of staph aureus. Blood culture. Option is TSS, SSSS, infective endocarditis, impetigo. Here the question asking about the blood culture positive. That means the organism found in the blood which are transmitted through circulation. The TSS, toxic shock syndrome. Toxic shock syndrome is a bacterial toxin by Staphylococcus aureus, which are toxin that cannot cause bacteremia of Staphylococcus aureus. TSS of staph aureus do not cause bacteremia. So blood culture will not be positive of TSS of staph aureus, while that of streptococcal TSS causes bacteremia. So question is asking about the staph aureus. So this is wrong. SSS, that means SS staphylococcal scalded skin syndrome. This also do not causes bacteremia, so it will not passes in the circulation, so blood culture is negative. This is also wrong. Another is D option, also wrong, due to impetigo. Impetigo also not causes bacteremia, so this is wrong answer. While that of infective endocarditis, it is due to infection transmitted to the valve of the heart. So here it, in case of infective endocarditis, the staph aureus are found in the blood circulation, so it will positive. So right answer is infective endocarditis. Next is incubation period of staphylococcal food poisoning is option is 4 to 6 hours, 6 to 12 hours, 12 to 18 hours, and 18 to 24 hours. The right option for that is 4 to 6 hours. This is frequently asking question. Incubation period of the staphylococcal food poisoning and the criteria of the food poisoning, clinical feature of the food poisoning. So you have to remember all the thing about the staphylococcus and streptococcus. This is most important in the NEET PG, AIIMS PG, all PG exam. So all the things about the staphylococcus and streptococcus you have to remember. Next is staph aureus causing vomiting in 16 to 18 hours. The mechanism of action is for such is the vagal stimulation. I am not going to detail about the option, so I am asking about the right option. The vagal stimulation causes the 16 to 18 hour vomiting. This is due to the toxin directly stimulate to autonomic nervous system rather than the local effect on the GIT. It direct causing the autonomic nervous system stimulation, and the toxin stimulates the vagus nerve and vomiting center of the brain. It's directly on the autonomic nervous system rather than the GIT mucosa. So vagal stimulation causes vomiting in the 16 to 80 hour, and while that of 1 to 6 hour vomiting, it is due to the GIT mucosa stimulation, irritation. Next is question is, a diabetic patient developed cellulitis due to S. aureus, which was found to be methicillin resistant on the antibiotic sensitivity testing. All of the following antibiotics will be appropriate except the option is vancomycin, imipenem, teicoplanin, and linezolid. The right answer you have to choose. Here the question asking about the diabetic patient developed cellulitis. Here the methicillin resistance on the antibiotic sensitivity testing was found. Then the MRSA resistant. Here the vancomycin is appropriate drug for methicillin resistant. Teicoplanin are used. Linezolid are also used. while that of the imipenem, the imipenem are active against the staph aureus, but not for the methicillin resistant. So the correct option will be the imipenem. Next is the drug of choice for MRSA. The option is penicillin G, ceftriaxone, vancomycin and cefazolin. The drug of choice for the MRSA will be vancomycin. Always you have to remember. Next question is about the following are characteristic feature of the Staphylococcus food poisoning except. The option is being optimum temperature for the toxin production is 37 degree Celsius. B. Intradiatic toxin is responsible for intestinal symptom. C is toxin can be destroyed by boiling for 30 minutes and incubation period is 1 to 6 hours. You have to choose right option. In general, the Staphylococcus growth is optimum at the body temperature, that means 37 degrees C. So this option may be right. Intradiatic toxin is responsible for intestinal symptom. That means the Staphylococcus toxin are preformed toxin which are consuming contaminated food loaded with Staphylococcus. So the intradiatic toxin responsible intestinal symptom, it is also right. The toxin can be destroyed by the boiling for 30 minutes. The fact about the Staphylococcus toxin. This toxin, staphylococcal toxin, which are relatively heat stable, that means it resists more than 100 degrees Celsius for 40 minutes. It can't be destroyed. So this option is wrong. Next is incubation period is 1 to 6 hours. This is also right. So correct answer for this is toxin can be destroyed by boiling for 30 minutes. Next is staphylococcal food poisoning includes the following feature. The incubation period of 24 hours, require immediate antibiotic, common with dairy products, heat labile enterotoxin. The question about the food poisoning and features. Here the incubation period. The incubation period of the Staphylococcus, you have to already know, 1 to 6 hours. They require immediate antibiotic. This is not correct. Here the treatment have to symptomatic only, no antibiotic required. Due to this illness, Staphylococcus food poisoning illness is the self-limiting illness and which are generally resolved within 10 hours. So requirement of antibiotic not necessary. Common with dairy product. The dairy product is most common causes of Staphylococcus food poisoning. The dairy product like milk, cheese, fish, meat, and uh, salad, potato salad, which all contains Staphylococcus growth. So the dairy product are common Staphylococcus food poisoning. So this is right. Heat labile enterotoxin. This is heat, not heat labile. It is heat stable enterotoxin. So right answer is common with dairy product. Next is staphylococcal scalded skin syndrome is caused by hemolysin, coagulase, enterotoxin, epidermolytic toxin. Here the question asks about the SSS syndrome. This is caused by epidermolytic toxin or super antigen. Next is a patient in an ICU is on a CBP line. His blood cultures show growth of gram-positive cocci, which are catalase positive and coagulase negative, the most likely etiological agent. This is looks like a long question, but this is not a long question. Here only you have to choose gram positive cocci. First of all, gram positive cocci. Here the catalase positive and coagulase negative. The catalase positive are Staphylococcus. Next, this is the idea to identify such type of question. Here the gram positive cocci. First of all, you have to choose gram positive cocci. Then after the catalase test, if the catalase test is the positive, then Staphylococci, and catalase negative, you have to choose Streptococci. Next is to, if Staphylococci, then coagulase protein. It is positive in the staph aureus, while that of negative in the coagulase negative Staphylococcus is the next is the if the coagulase negative Staphylococci, the novoviocin susceptibility testing is done. Then if the novoviocin susceptibility testing is positive, that means it is Staphylococcus epidermidis and hemolyticus, while that of it is negative in the saprophyticus. So this is the idea to identify the which is Staphylococci or Streptococci, and the organism or strain of the Staphylococcus you can easily identify by this. So you have to remember such type of the topic. So according to this question, the catalase is positive. Catalase positive, that means the Staphylococci, and coagulase negative, that means it indicates Staphylococcus aureus. So you have to choose right answer. I will also upload this topic in the separate video. Next is staph aureus. Virulence is due to coagulase, endotoxin, hemolysis, and pigmented colonies. So already told about that the staph aureus virulence is due to coagulase and lesser extent to the mannitol fermentation. Next is the true about protein A of the staph aureus. Causes opsonization, binding to Fc part of the IgG, stimulate phagocytosis and the T cell mitosis. The option is here the binding to Fc part of the IgG. Due to it binds to Fc terminal of the IgG, especially if IgG 1, 2 and 4 but not 3, and prevent opsonophagocytosis. So opsonization phagocytosis, and also not for T cell mitosis. So here it is antibody reaction, not antibody, that means immunoglobulin, not T cell. So right answer is B. Next is all of the following are true about methicillin resistance in the MRSA except option is resistance is produced as a result of altered penicillin binding protein. Resistance may be produced by hyperproduction of the beta lactamase, and resistance is primarily transmitted via plasmid, and resistance may be missed at incubation temperature of the 37 degrees Celsius during susceptibility testing. The first option is the resistance is produced as a result of altered penicillin binding protein. This is right, true. And resistance may be produced by hyperproduction of beta lactamase. This is also true. While that of the resistance is primarily transmitted via plasmid. This is wrong due to the resistance is in the Staphylococcus. About methicillin resistance, it is transmitted by chromosome, not by the resistance is primarily transmitted via plasmid. This is the wrong. The resistance transmitted chromosomally. So this is wrong. And resistance may be missed at incubation temperature of the 37 degrees C during the susceptibility testing. It is due to the methicillin resistance is expressed more at the 30 degrees Celsius than at 37 degrees Celsius. So the correct option will be C. The next is the enterotoxin responsible for most of the cases of the food poisoning by the Staphylococcus type E, type C, type B and type A. So you have to choose correct answer is type A. The most of the cases this causes type A is responsible for the most of the cases of the food poisoning of the Staphylococcus. Next is which of the following statement is most correct regarding resistance to methicillin in the MRSA? Resistance is produced as a result of alteration in the penicillin binding protein. Resistance is produced by production of the beta lactamase. Resistance is mediated by plasmid. Expression of the resistance is enhanced by incubating at 37 degrees Celsius during susceptibility testing. These are also repeated question, already told the. So the correct answer will be the resistance produced as a result of penicillin altered. Resistance is produced as a result of alteration in the penicillin binding protein. This is the correct. The resistance produced by production of beta lactam is here the overproduction is required, and plasmid mediated wrong, and 30 degrees also partially wrong. So best option will be here. Next is the transfer of the drug resistance in the Staphylococcus is by transduction, transformation, conjugation, and transfaction. Here the transduction is more correct option. So this is transduction is correct answer. Next is the Staphylococcus oxacillin resistance is best detected by cephalexin MIC, cephalexin disc diffusion, oxacillin disc diffusion, oxacillin agar. So you have to choose a right option. Here the right option is cephalexin disc diffusion. Due to first option cephalexin MIC, this is not recommended by clinical and laboratory standard institute. Cephalexin disc diffusion, this is most commonly used to predict Maca gene, Maca gene. Then oxacillin disc diffusion. So better is cephalexin disc diffusion. And so right option will be the cephalexin disc diffusion. Next is which of the following is not mechanism for resistant to MRSA? Here the note mechanism asking about. So resistance is chromosomally mediated, produced mainly by alteration in the PB, and MRSA resistance is absolutely beta lactamase independent, and intrinsic resistance is non. Correct. In that the resistance is chromosomally mediated, it is right option, produced mainly by alteration in the penicillin binding protein, it is also correct. MRSA resistance is absolutely beta lactamase independent, it is wrong. And intrinsic resistance is non, it is also right. So correct option in that will be MRSA resistance is absolutely beta lactamase independent, it is dependent. So next is a child after consuming food in the party complain of the diarrhea within 1 to 5 years. The diagnosis is staph aureus, Streptococcus clostridium perfringens, Clostridium botulinum. This is the already told, it is a staph. So correct option will be staph aureus. And in the 1 to 5 hour or 1 to 6 hour, the another organism also, the Bacillus cereus. The incubation period or food poisoning within the 4 to 6 hour for the cereus. Next is the which organism causes toxin shock syndrome. Toxic shock syndrome: pneumococcus, E. coli, Staphylococcus aureus, or enterococcus. This is easy question, so Staph aureus is the correct answer. Next is the toxic shock syndrome is caused by The option is Streptococcus pyogenes, Staphylococcus aureus, Streptococcus albicans, and endurance. So toxic shock syndrome. The correct answer, you have to choose the correct option in that is Streptococcus pyogenes and Staphylococcus aureus. Both already told the toxic shock syndrome is produced by toxic shock syndrome caused by Streptococcus and Staphylococcus both. So correct option is both. Next is all of the following statements are true regarding Staphylococcus except here you have to choose wrong option. A majority of infection caused by Coagulase negative Staphylococcus are due to Staphylococcus epidermidis, and next is beta-lactamase production in the Staphylococcus are under plasmid control. Expression of the methicillin resistance in the Staphylococcus aureus increase when it is incubated at 37 degrees Celsius in the blood agar, and the methicillin resistance in the Staphylococcus aureus is independent of the beta-lactamase production. So you have to choose correct option, that means the which is wrong. So start with the first option. The majority of the infection is caused by the Coagulase negative Staphylococci are due to Staphylococcus epidermidis. It is already told that the Coagulase negative Staphylococcus novovirus residents all are the epidermidis, so it is the right option. The beta-lactamase production in Staphylococci under plasmid control. This is also beta-lactamase production are plasmid control, while that of the expression of the methicillin resistance in the Staphylococcus aureus increase when it is incubated at 37 degrees C. So this is not right answer. It is expressed more at 30 degrees Celsius than 37 degrees Celsius, while that of the methicillin resistance in the Staphylococcus aureus is independent of beta lactamase production. Here the methicillin resistance, the option here wrong, this is also right, and the expression of the methicillin resistance, this is the right option, that means it is wrong. Next is scarlet fever. Scarlet fever is caused by Streptococcus, Staphylococcus, Klebsiella proteus. Then this is already told, this is which is correct option. You have to choose this. This is Streptococcus. So thanks friends for watching my video, and please write in my comments box for your better performance. Thanks again for watching my video. Have a nice day.